The reason that it's possible for that to be happening, and the NHS under extreme pressure, but not at the point where it was by any means at the turn of the year, is because of vaccination. But we are entering the winter with this reasonably high level. It wouldn't take many doubling times to get into trouble, and therefore people still need to take this disease very seriously, because I don't think you need a medical degree to know that autumn and winter is when respiratory viruses are hugely advantaged, flu and others, as people come together indoors, windows closed and so on. So it was really just a reinforcement to people. If you've not had your vaccination, now is a very good time to do so. Thank you very much.
Thanks very much, Chris. Patrick, anything to add to that? Let's go to questions there. Thanks very much. Let's go to questions from the public. First, Michael from Dorset. Michael asks, the government suggested in March 2020 that 20,000 deaths from COVID-19 would be a good result. Why then is the PM not doing anything to prevent even more unnecessary deaths? Well, Michael, I'm not certain that that was what we suggested, but what we are doing, of course, with all our policies is and everything we've done since the beginning of the pandemic is to prevent unnecessary deaths. Everyone has been a tragedy, but I think I'm right in saying that I think I saw a statistic from Public Health England saying that the vaccination programme alone had saved perhaps 100,000 lives, maybe 120,000 lives, and that's why what Chris has just said about getting your jab is so absolutely crucial. Thank you, Michael. Kirsty from Leeds. Can the government advise on when the strict travel rules will ease further for those that are fully vaccinated, and advise on what determines a country's list? At the moment, travellers are confused about where they can go when countries that have low COVID rates and good vaccinations are still red. Thanks very much, Kirsty. I appreciate that people are very frustrated about the travel rules, but it is vital that we do whatever we can to stop the virus being re-imported, and particularly to control new variants when they're at risk of coming in. That's why we have the rules. That's why we have the red lists. And I know that travellers have been frustrated this summer in having to take tests in order to do it. But I think it is reasonable to ask people to do that to help protect the population. We'll be saying a lot more shortly, Kirsty, about the traffic light system, about simplifying it, and about what we can do to make the burdens of testing less onerous for those who are coming back into the country, Kirsty. But that will be coming shortly. Let's do questions from the media. Vicky Young from BBC News.
Prime Minister, could I just start on behalf of all of us by extending our condolences to you and your family after the loss of your
Thank you very much.
Could you tell us in what circumstances you would impose those extra restrictions, your plan B? Do you have a number of cases, a number of hospital admissions, which would mean that we've passed that threshold? And a similar question really to Professor Whitty and Sir Patrick. When do you think extra restrictions should be imposed?
Well, Kirsty, Vicky, sorry. First of all, thank you very much for your kind words, and to many others who've said the same. But on your point about Plan B and when it and how and what the trigger might be for that, I think that just bear in mind what we're trying to prevent, and that is the overwhelming of the NHS, and that's got to remain the objective. There are all sorts of data that we'll continue to study, as we have throughout the pandemic, in deciding what the risks are, what the state of the disease is. We'll keep you updated about where we are. You've heard the exact state of things at the moment, and we're confident we can proceed with Plan A. But I think what I would stress about Plan B is that it contains a number of different shots in the locker, and you wouldn't necessarily play them all at once. Far from it. You'd want to do things in a graduated way. And I just emphasize what I think Patrick has said many times, that we're now in a situation when, because so many of the population have some degree of immunity, smaller changes in the guidance, smaller changes in the way we're asking people to behave can have a bigger impact, and a smaller tilt on the tiller, if you want, can effect a bigger change in the direction of the pandemic. And maybe Patrick can say more about that if you want. Patrick, you want to?
Yeah, I mean, we've got high levels of immunity now, and if, as Chris said, we can get everybody who's not vaccinated to be vaccinated, so that's the most important thing we can do. There are 5 million or so people who are eligible for vaccines now who haven't been vaccinated, and trying to persuade those people it's the right thing to do to get vaccinated would make a significant difference. So getting that immunity up means that then the barrier against rises is that much greater. If you think about where we are now with infection rates and the openness that we've currently got, if you tried to do this 6 months ago, the number of cases and deaths and hospitalizations would be through the roof. So the immunity is really important to keep this down, and allows lighter measures to be put in place to keep it under control. That said, the things to look at are hospitalizations. They are really, really important as a marker of when things are going in the wrong direction, and the relationship between cases and hospitalizations, because one of the things the vaccines has done is made that relationship really much less. So if you saw that changing again, that would be a cause for concern. So those are things to look at. And the final thing to say is that the principles which have been really clear, I think, right the way across the world, are when you make a move, you have to go earlier than you think you want to, you have to go harder than you think you want to, and you need to make sure you've got the right geographical coverage. So if this goes in the wrong direction and cases go up, followed by hospitalizations, it's important that the measures are put in place early enough and they're significant enough.
Thanks.
Can I just add slightly to that, PM? I mean, I think in addition to what PM and Patrick have said, I mean, there are three things which I think is worth looking at. The first of which is the absolute numbers going to hospital. The second, though, is the rate of change. A gradual drift up is one thing. If you suddenly saw a very rapid increase, then you have to consider taking earlier action. And the third of which is the overall state of the NHS, which of course does vary over the year. And as you go into winter, there tend to be greater pressures. So these are all the kinds of things that will need to be taken into account. But no one is claiming there is a good number. We would all like the numbers to be as low as possible. But in terms of what might trigger change, those are the things which I think are the most likely.
Good. Thank you very much. Robert Pesson, ITV.
Obviously, we're all relieved the way in which the vaccine reduces severe disease. Actually, I've just myself recovered from COVID, double vax. But as your chart showed, numbers going in hospital are 5 times what they were a year ago. Sorry, 4 times actually. Deaths are 5 times what they were a year ago. And as you pointed out, we're about to get colder weather. We're going to be indoors more. Kids are going back to school. What is the argument for not taking mild suppressive measures now as a preventative measure? And separately, on boosters, you'll have seen the Lancet paper, scientists from the WHO, American FDA and others, and we've seen what Sarah Gilbert said in Oxford. The argument for, in their view, the argument for boosters is not overwhelming, and many of those people think we'd be doing a better job sending those vaccines to countries that haven't got any vaccines at all at the moment, particularly places like Africa. Why do you disagree with that judgment? Because it is an important judgment difference. Well, the scientists for the latter one, and all of you for the question of why not take, prophylactic action, even of a mild sort, now.
Just to say to you, Robert, on that, because the vaccines have made a huge difference in reducing mortality. So the ratio of cases to serious disease and deaths is vast, and we are continuing to advise everybody to be sensible and responsible. So Plan A, what we're doing at the moment, continues to continue to think about using a face covering in a confined space when you're meeting people you don't know. Wash your hands, use ventilation, get a test, stay at home if you feel unwell. These are very, very important restrictions that I think people, or ways we behave responsibly, that people should continue to maintain. But I think that's the right balance, given where the pandemic is at the moment and given what we've been able to achieve. And I think that the priority should be for literally 5 million more people who could get a vaccination, and who haven't yet done so. And those are the people that I think we should be encouraging now to come forward, get your jab. It will be good for you for the numbers, the reasons that Chris has set out. You're overwhelmingly more likely, sadly, to die or to suffer serious disease if you haven't been vaccinated. And so vaccination, I think, should be the key thing we advocate.
Can I just add to that? So firstly, on the measures, if we had a situation where everybody was back to behaving as they did prior to March 2020, we would have a much higher rate than we do at the moment. So actually people are taking measures. Everybody's taking, well, everybody's taking, but lots of people are taking measures. They're meeting with fewer people. Good research demonstrate that. Many people are wearing masks in crowded places and all the other things that the Prime Minister has talked about. So it's not that we're not taking measures. There are quite a lot of measures, and lots of people, probably the great majority of people still, are taking some or a lot of measures to reduce the risk that they and other people get infected, in addition to being vaccinated, which, as the Prime Minister has said, is the most important thing. So I think we shouldn't just say there's nothing happening. There clearly already is. On boosters, I think it's important to separate out two things, which I think if they get conflated, leads to confusion. The first one, which everyone would agree with, and the Prime Minister said in his remarks, is everybody agrees we want to get vaccines out all around the world, including low-income countries. That is an absolute moral imperative. It is also an absolute practical imperative for everybody, and everybody agrees with that. That isn't a contentious point. The second question is there some waning of immunity that means that a third dose, a booster dose, is a sensible thing to do? And I think there is now reasonably good evidence that that is the case. The UK has taken, in a sense, a middle way on this, led by the JCVI. It has neither said no boosters at all, because there is evidence of waning, particularly at the top end of the age range and in those who've got pre-existing health conditions. And those are the groups that JCVI have actually recommended it, in addition to health and social care workers, because of the chance that this is going to reduce the probability they will infect others. So that there's a very good logic, but they've not gone all the way of recommending universal boosters for everybody. So they've taken a middle path, which some nations have gone for. But the logic of the boosters for the UK is, I think, is clear and science-based, and the ethical imperative, as well as the overall need to do that, I think is widely agreed. And those two, I think, are separate discussions. If we suddenly stopped having boosters, given the particular vaccines we're using, which are the mRNA ones with very ultra cold cold chains, actually at the moment not long, very long shelf lives, the idea that's somehow going to transform the situation in lower income countries, I think, is a misunderstanding. I think those are separate issues, but both are important.
Yeah, just to build on that, and I agree completely with what Chris has said. If you think about the degree of immunity we've got and the levels of behavioral restriction that people have imposed upon themselves, so people aren't meeting as many people, we know contact patterns are still quite a long way down compared to where they were, but they are changing quite fast. The faster they change, the more pressure this is going to come under, and that may well lead to a significant increase. If you look at, go just across the channel, countries where you've got similar levels of immunity and some higher degrees of restriction, what you can see is that the cases are going down. So you can see we're sort of at that pivot point where things are flattish at the moment. If they go up quickly, then, as I've said, you've got to go early in terms of getting on top of it. You can't wait till it's late because you have to do more. So that's sort of where we are on that. And on the boosters, the waning of immunity is clear. It's greater for infection than it is for the waning against hospitalizations and deaths. So they're holding up very well. And I want to just say the really important point is these vaccines are really good. They are really effective vaccines, far more effective than we could dared have hoped for at the beginning. So this is some waning. And that waning is most evident in the people who are most at risk. And so getting on and getting that topped up does two things. It gives a very high level of antibody coverage, and it probably broadens the coverage across variants as well, because you've got such high response. So I think it's a sensible thing to do. JCVI have considered it very carefully, and I think their recommendation is a very sensible one.
Great, thanks. Gary Gibbon, Channel 4.
Thank you very much. Professor Whitty, you talked a bit about the metrics for how we might decide we've got to move from plan A to plan B, lockdown light, maybe. What about the trigger? Is it most likely, do you think, that it'll be a new variant that would change the game here? Is that the real game changer that you'd be expecting to transform the horizon there? And when the Prime Minister he would urge people to consider wearing a face mask in crowded indoor places, you say we're in a very serious condition. Is considering it enough? And Prime Minister, on vaccine passports, you said in this building in July, you served notice that you're planning to bring them in. Were you really planning to bring them in? Were you just trying to get the numbers up of younger vaccination? We've then had lots of other mixed messaging, which isn't great in public health. What's going on?
Thank you. In terms of new variants, certainly new variants are one of the things we need to look seriously at. Now, of course, variants are happening the whole time, have always happened. What we need, the worry would be one that can escape from the vaccination. So the Delta variant is a very bad variant. I mean, let's be very clear, it's a very bad variant. And that's the reason we've had such trouble in the last year, as every country around the world. We have not faced a winter with the Delta variant. So it is possible that the combination of winter events plus the Delta variant, which is highly transmissible, could lead to a situation where, on the basis of the data, ministers decided that they wanted to trigger all or some of the Plan B, as the Prime Minister's laid out. So I think we have to take it as it comes. I think anybody who can say with confidence they know how this is going to work over the next few months has not fully understood, I think, the range of possible ways this could happen. But certainly, were there to be a variant that was both transmissible and escaped from the vaccines, that would put us in a new situation. And no doubt the Prime Minister would come back where he wished to go at that point in time. But we're not at that point in time. I think at the moment our expectation is the Delta variant, but over autumn and winter is what we face at the moment. And then in terms of masks, I think my previous suggestion to people remains my view, which is if you are in a crowded environment, particularly if you're in an indoor space, wearing a mask is a way of helping protect other people. Being vaccinated really helps protect them, but it's not a complete protection. People can get infected and they can transmit vaccinated. There's much lower probability to both of those. Wearing a mask helps to reduce that. It's not something you need to concern yourself so much if you're outdoors in highly ventilated areas. And the other area where I think it is sensible is if actually you've got people around you who wish you to do so, either because they've got medical conditions or simply because that is their desire. I consider it an issue of common courtesy. There are a number of situations you would want to wear a mask, but that's not universal, and it's a recommendation. It's not something which the government has put into regulation.
Excellent, thank you. And look, just Gary, on your point about COVID certification and vaccine passports, as it were, I really do defend these in principle. I think it was right to set out in July that we could go forward with those measures. And actually, what has happened is, I mean, if you think about a year ago where we were, last September, can you imagine if we'd had then COVID certification, we would have been able with that tool to keep open businesses that had been forced to close and were going through an absolutely wretched time. They would have been a total game changer, lifesaver last year. And so I think that they're important they're an important part of our repertoire. And it's great that loads of events have been working to use them. People have been making the system work. And as I said earlier on, we may because of where the disease gets to, we may have to use them in a more thoroughgoing way. We reserve the right to come back to you and say we think that that's going to be necessary. And I do think the public understand that. They can see how it could work. There are plenty of other countries that are doing it right now. But at present, we don't think it's necessary to proceed on that basis. We think that we can keep going with all the stipulations that I mentioned and Chris reinforced that we're asking people to observe. We think that's the right balance given where the data is now. But you've got to be mindful that this disease does have a way of changing and moving. What is absolutely for certain is the vaccines made a vast difference. And if the single, what I hope people take away from this this press conference above all is not perhaps the importance of Plan A or Plan B, but that fixing that gap in the number of people who have had their vaccine of whatever age, and that statistic about the risks to an unvaccinated 30 person in their 30s seems to be very, very powerful. And I would just, the numbers are going up, and it's interesting to see how many people are coming forward to get vaccinations. And I would just urge who is still a bit apathetic about it to join the club, because it's worthwhile. Steve Swinford, The Times.
Professor Whitty, one of the world's biggest female celebrities, Nicki Minaj, has today publicly linked the coronavirus vaccines to impotence. Now, she's got 8 million followers on Twitter. Many of them are young people, the young people you're suggesting should get vaccinated. What would you say to them, and how concerned are you by public comments like that from public figures? Prime Minister, SAGE and SPI-M have both advised that the government, that working from home is one of the single most effective measures at reducing transmission. But looking at your autumn and winter plan, it's not actually part of Plan B. It seems to kind of hover as some kind of Plan C with a decision on its shelf for a later date when we actually look at the document. Why are you more reticent about deploying working from home to combat this? And one last question. Prime Minister, a lot of your cabinet are feeling very anxious as we're gathered here today about their own futures. Can you formally rule out a reshuffle ahead of the Conservative Party conference?
Chris, on the reshuffle.
Thank you, Prime Minister. So there are a number of myths that fly around with varying, some of which are just clearly ridiculous, and some of which are clearly designed just to scare. That happens to be one of them. That is untrue. My own strong suggestion, if I may, to media present and not present, is repeating them in public actually just gives them credence, which they don't need. They're untrue, full stop. If you think about where we are actually overall, and this is a slightly longer answer to your question because I think it's a very important one, the great majority of people are getting vaccinated. So the great majority of people are ignoring these myths. And if you talk about people in their 50s and 60s and 70s, you're talking about over 90% of people getting vaccinated, and very few people actually are actively, in a sense, in the anti-vax group. There are a group of people who've got strange beliefs, and fine, and they make their own choices, and in a sense, also fine. Adults are allowed to make their own choices, however strange. That is a basic principle of medical ethics, actually. But there are also people who go around trying to discourage other people from taking a vaccine, which could be life-saving or prevent them from having life-changing injuries to themselves. And many of those people, I regret to say, I think know that they are peddling untruths, but they still do it. In my view, they should be ashamed. And I'll leave it at that.
And I'm just on that, Steve. I'm not familiar with the works of, or not as familiar with the works of Nicki Minaj as I probably should be. But I am familiar with Nikki Kanani, superstar GP of Bexley, who's appeared many times on before you, who will tell you that vaccines are wonderful and everybody should get them. So I prefer to listen to Nikki Kanani. And on your point about working from home, this is one of those things where I think just look at what the public are doing. I think people are coming back to their offices. That you're seeing the numbers that I'm reading suggest that people are more confident. They're getting back into their places of work for the reasons I've given many times before. I think that that's a good thing. I think that on the whole, particularly for younger people, you need the social capital you get from the workplace. You need the learning from colleagues. I think that will, on the whole, be more productive, and it's fairer to everybody if we can do that. But people are also being sensible and responsible. If we have to change the guidance that we give on that, then we will. But that's Plan B. As you've heard earlier on.
Can I just add to that, Prime Minister? I mean,
Yes.
the point about something like working from home, it's about contact patterns. And in a way, this is all quite straightforward, that disease spreads much more rapidly the more contacts we have. And in certain environments, the more contacts you have are more risky. And working from home is just a way in which contacts inevitably go down. So that's why it was highlighted as a particularly effective measure to decrease spread at times when you have big increases in levels.
Thanks. Lizzie Buck in the Mirror.
Thank you, Prime Minister. You've spoken about reserving the right to use vaccine passports, and the Plan B document states that they could be imposed for nightclubs and large venues, but it doesn't entirely rule them out mandating them more widely. Are you considering imposing them in pubs, or would you like to rule that out? And to the scientists, what are your views on the evidence behind the use of vaccine passports? PHE found that they mitigate the risk of transmission, so why are we not using them now?
Thanks very, very much. But no, Lizzie, I've never been in favour of vaccine passports for pubs. I've been, I think, pretty clear about that throughout the pandemic. But I do think that there are settings, as we put it, nightclubs, large music venues, and so on, or venues with big, closely packed crowds, where they might be appropriate. As we all know, some events have been using them over the summer very effectively to get going, and I think it would be sensible for a government not to rule that out.
In terms of the question to us, I mean, the question about whether it's a passport is entirely a one for political leaders. That's a legislative and societal one. From the science point of view, though, I think nobody would doubt that you're safer off if you go to any indoor venue where everyone around you is vaccinated. It reduces the probability they will get COVID at all. It reduces the probability if they do have COVID, they will pass it on. And if everybody in the environment is vaccinated, the chance of a mass spreading event is very substantially reduced because everybody's got it. So things that are to encourage everybody to get vaccinated, particularly if they're going to large mass events indoors, the evidence that is going to be a good idea is rock solid. How that's done is very much a matter for ministers.
Good, thank you. Adam Payne, Politics Home.
Prime Minister, a question for you, please, on the potential mandating of vaccine passports. Michael Kill, who's the CEO of the Nighttime Industries Association, told Politics Home today that the government's handling of this issue has been chaotic and that Plan B could force nightclubs and venues to make massive logistical changes at a moment's notice. What's your message to Michael and that industry, and to Professor Whitty and Sir Patrick, please? Do you have any data on the effectiveness of the booster shot? Professor Ferguson yesterday said a study in Israel suggested people were 10 times less likely to catch mild disease after receiving a third dose. Do either of you have any information you can share on that, please?
Yes, so thanks very much, Adam. On nightclubs and the whole nighttime economy, we want to keep it open. And the big difference between this year and last year is that thanks to vaccination, we are able to keep it open. It's a great thing. We just have to be sensible and look at the risks that we face. And I think that some sort of COVID certification system of a kind that plenty of venues have been using already might well be sensible. We're working with the industry, including the nightclub industry, to make sure that they understand what could be required of them. And of course, I understand the frustrations of people who are wondering whether or not they're going to have to put this in. At the moment, we're confident that you won't, that we'll be able to proceed without it. But the choice is, and the reason for wanting to have this option is because it's a choice that then between proceeding with COVID certification or sadly once again asking places to close. And I certainly don't want to do that. So that's why I think it's a good idea to keep this up our sleeve in reserve.
And on boosters, I mean, it's very clear that the booster shots cause a very big increase in antibody responses, and that would be expected to have a very big knock-on effect for protection in terms of infection and hospitalizations and death. So I think the data look pretty clear on that.
One just final point, which is on the first one. I think there's a lot of people believe young people aren't taking up the vaccine. Not true. The great majority of people 16 to 29 have already taken up their first vaccine and are taking up their second. So the idea that this is just a minority of younger people who haven't is completely untrue, and we should always start from that basis.
That's right. Thanks very much, everybody. Thank you. Thank you.